are here today to talk about the issue of medical student engagement with aging, brain health, and dementia in the MENA region.
I think it's not, unfortunately. As I said earlier, the curriculum is it's more or less a traditional curriculum that's been applied in most of the school. Although there is some curriculum, they say that it is innovative curriculum and it's a problem-based curriculum. However, the problem of geriatric population are not very well tackled in these curriculums. So we can see that most of the graduate, when they graduate from medical school, they lack either the knowledge or the skills or the attitude towards the elderly population. When the doctor graduates from the medical school, they lack that knowledge. But luckily now with the residency program that we developed for the family physicians, we try to tackle these issues in order that the people, the family physicians will care for the elderly, because it is the patient that they see first in the health center before they go to the hospital. So they acquire a bit of knowledge about how to deal with dementia and other problems, yes. The best department to tackle that issue, since one of the goal of its goal is prevention and early detection, is the primary healthcare and family medicine. Because within that department, there is a lot of teaching is being done and training is done to the medical students in trying to detect problems as early as possible and trying to prevent complications. So if we include brain health as well as dementia within that department, that will be the ideal setup. The family structure have changed. We used to have the extended family where the young and the elderly people, they live under one roof. So we can see that the young people will get support, psychological support from the wise elderly people, and the elderly people will get physical support from the young generation. However, that has been, or it is going to be disintegrated. Many of the young people, they live alone. So they don't care much for their elderly people, and the elderly are tending to live more alone by themselves, facing all the physical challenges around them. So that is something which is happening. With regarding to the doctors being kept in the society, at least I'm talking about the Gulf region, we don't have a lot of migration of doctors to overseas. However, they go there to gain higher studies and they do come back. And the reason for coming back, there are many reasons for that, because the income is higher than other countries. And then there is a stability, which is a social and psychological stability when they are here around their families. But again, we can give more intensive for the medical graduates, fresh graduates, in order to maintain them within the country. And that is by at least if they go into this specialty of geriatric medicine, we have to equalize it with regard to the income and social status with the other different specialties there. Because that is one of the main reasons why fresh graduates do not go into specialty of geriatric medicine.
The migration of physicians from the Gulf to the outside is very rare. I mean, migration of physicians mainly happen in the other part of the region, mainly Lebanon, Syria, Iraq, Tunisia, the places that are not stable. Egypt as well, all those countries. So for the Gulf, it is better for the physician to return to his own country.